The challenge that we're considering, though, is how can we give it and when can we give it?
Well, thank you for joining us tonight. I'm Javier Soto. It is a therapy for COVID-19 patients doctors say has the power to save lives, and it's called monoclonal antibody treatments.
A Valley doctor wants to give it to his own patients without having to send them to another hospital. Whitney Clark is on the story, joins us live from the newsroom to explain where you can find it and the challenges that come with it, Whitney.
So state health officials tell me there are nearly 200 providers in our state who can give monoclonal antibody treatments, and they estimate more than 1,000 Arizonans a week are likely getting them. Now, a family physician based in the Valley is starting the process to have it available in his office. Nearly 2 years since the COVID-19 pandemic began, and Dr. Andrew Carroll's office is a familiar testing site.
Oh, goodness, we're seeing quite a few. There was a lull there about maybe a couple months back where we weren't seeing any, but we're definitely diagnosing somewhere between 5 and 20 new COVID patients each week.
He hopes to offer monoclonal antibody treatments to his COVID-19 patients at risk for complications.
But having the ability to deliver it right here in a familiar and very comfortable environment by people that they trust, I think is important to our patients, which is why we're looking at offering it here soon.
It's a lab-developed treatment doctors say will help folks recover more quickly from a COVID-19 infection, designed to keep you out of the hospital, but it has to be given early on in the illness.
We are incredibly hopeful that we will see greater availability of monoclonal antibody therapies over time.
Jessica Rigler with the Arizona Department of Health Services says it recently created a map where you can find facilities offering the monoclonal antibody therapy approved for emergency use by the FDA. So why isn't it offered in more locations?
A lot of the available treatments, though, require an infusion. So that's where you're getting an intravenous infusion of the therapies. And that process can take 2 to 3 hours.
Not all doctors' offices have rooms available for that long or the staff. Dr. Carroll has plans on how to do it safely, separating COVID-19 patients from healthy people. He tells me it can be frustrating to have to refer your own patients to someone else.
This is a therapy that we know works. We're using antibodies like we know how to use antibodies. Our body uses antibodies to help fight infection, and this is specific to that. These are human antibodies that we use to treat this infection.
It is important to note here, those experts tell me, while we're lucky to have this drug for those who do get sick, the COVID-19 vaccine is always going to be our first line of defense. In the newsroom, Whitney Clark, Arizona's Family.